I'm here live at ASN, American Society of Nephrology, 2023 in Philadelphia, Pennsylvania, to go around and ask the question, what is the future of kidney care and what are you doing to implement it? The goal here is to ask people, how are we improving the lives of people with CKD, chronic kidney disease, and those patients on dialysis? On today's video, what is the future of kidney care? All right, we got David Rush with the wins only mentality, correct?
Wins only lifestyle, but
wins only,
it is a mentality.
Wins only lifestyle.
Nah, you're good.
A patient advocate, a dialysis patient, a transplant guy, everything, right? Tell us, what is the future of kidney care?
The future of kidney care is innovation. As long as we're moving forward in a good direction, kidney care, unfortunately, may be with us forever. But as long as there's innovation in companies, competitiveness helps innovation move forward.
Absolutely.
As long as those things are happening and the conversation doesn't die. But I think the main thing that needs to happen is the patient needs to always be involved.
Absolutely.
And I think that the patient perspective will always give businesses, people who are innovators, always an instinct to keep us in mind.
Absolutely.
Patient
focused, patient centered.
Yes.
Absolutely.
And of course, because at the end of the day, we're the ones doing the treatment, right? Everyone has in mind for their business to get the best product done. They want the best engineering. They want the lowest cost. But at the same time, I want you to think about the patient as well.
Absolutely.
Because the future of kidney care is the patients.
Absolutely.
And the innovation.
Thank you so much, man.
Thank you, man.
Appreciate it.
So I'm in AI, so I'm going to say that AI is the answer. But, like you give a hammer to a nail. But so I think there's two answers. There's tactically, right? Yeah. So utilizing AI in the clinics and in the practices to prevent hospitalizations and stabilize so people have a longer life, more hugs with their grandkids or whatnot. But strategically, long-term is moving down the value chain into chronic kidney disease in the practices, identifying them earlier, maybe in 2 or 3A, holding them for 5 or 20 years and driving that longevity. And they'll probably, kidney disease will not be the reason for death.
I think the future of kidney care is, in 10 years, I think you're going to see a really neat blend of the patient's data optimizing their kidney care. So I think in 10 years, you're going to see, I think there's a really neat journey to be had. You're going to see home systems that are ingesting the data that the patient has effectively given them, if you will, by a wearable, whatever it might be, throughout the day, and totally effectively auto-titrating dialysis, for example, for patients, right? So being able to say, the machine automatically knows
your potassium,
is a little high, your fluid's a little low.
Not a one size fits all.
It's not going to be one size fits all. I think it's really going to be, and that's where we want to go, right? Everything in the world is about precision medicine and being there for the patient. And I think dialysis can be too.
So I think the future is at home. At home, traveling, living.
And mine would probably be portability, just almost to where it's in your pocket, and that's, the way it's going. So,
and that's for dialysis, right?
Yeah.
And you guys have really experienced the benefits of home dialysis.
Absolutely. We travel all over the country, and we have our dialysis machine in the hotel right now.
Oh, we're living on dialysis.
Absolutely. And that's probably one of the key things is on dialysis, you can live your life. It just takes a little bit more planning. If you want to check out more videos of her and us traveling, #BlindChickLiving, and check us out.
#BlindChickLiving.
Yep.
I love that hashtag. That is the best hashtag ever. So, thank y'all.
The future of kidney care really is more choices for the patients, better treatments, better outcomes, and that's through improved product utilization and also the improvement with pharmaceuticals. So people are coming into renal failure healthier.
Awesome.
Than previously.
And you're generally optimistic about the future of kidney care?
I am.
And it's changing, right?
It is changing daily, and what's changing is whether we're going to treat them in a dialysis unit, or if it's going to be a pharmaceutical.
Okay, we start with John telling the story of our...
we started like 12 years ago with the Just Kidney Foundation, and we want to make a breakthrough for patients so you can have access to frequent dialysis every day, wherever you are. So we made a small device that actually is portable, you can bring to your home, you can take with you, you can travel with it. Make sure that every day you can have a short period of treatment and make sure you have your ultrafiltration on a daily basis and you'll just feel better as a patient. So that's where we started.
The future of kidney care is portable.
it's portable and to give patients the autonomy back again, to have the power on their own lives so that they can decide when to do the dialysis, where to do the dialysis.
Excited to be here with all the new innovation we're seeing with patient-centered care, upstream, meeting a patient where they are and focusing on polychronic is where we think this is going. The recognition that kidney disease is not in a silo, and upstream care, particularly with STOH, medications, recognition of barriers to care is going to be crucial to where kidney care is going to go in the future. And I think a de-emphasizing of dialysis is the only option for patients.
A de-emphasizing of dialysis,
so
correct?
Dialysis is not for everyone. When utilized appropriately, it can save lives and extend lives till transplant. But really, dialysis should not be the default going forward. It really should be an option for patients who are approaching end-stage kidney disease along with transplant and conservative care.
Oh, the future of kidney care is very optimistic. We're very excited about the future of kidney care. I think this is the first time we're seeing technology and the clinical all meshed together. It's always been very siloed. So this part, leveraging technology to be more proactive than reactive, I think that's where we need to be. And in addition to that, the medical device, the software is going to help give us the tools we need to increase home penetration rate, but also prevent hospitalizations and be more proactive when it comes to remote patient monitoring, when it comes to some of the devices that we're seeing now in the home hemodialysis space, as well as in the peritoneal dialysis space. So yeah, we're very excited about the future of kidney care.
For me, and really for the culture at Diality, the future of kidney care is therapy that is flexible and adaptable, nimble enough to meet the patient where they're at.
Yeah.
There are multiple care settings. You mentioned that I grew up with a patient at home.
Yeah, absolutely.
That was a difficult journey, but it was something that we did because
your life's life experience with your family, is that really what driving you right now?
100%.
100%, right?
Yeah,
absolutely.
Like I said, it was
this is a first-hand mission for you, really, right?
Yes. When I came to this company, that was what really sunk my heels in, was the flexibility of what we're working on and the ability to really meet patients where they're at.
I would say home penetration. The biggest thing is you really want to take healthcare home. You're seeing it in ERs, you're seeing it with hospital systems. And the more that we can make sure that we're not disrupting the patient's life, the better it is. And honestly, though, the biggest thing is go upstream.
Yeah.
Never have to be on dialysis.
Absolutely.
That's the number one goal.
Well, Dr. Butt, the future of kidney care, I see it available anywhere, anytime. I see patient choice and convenience, something that's accessible, effective, and delightful. But really, going beyond kidney care to kidney health, so that people don't even have to worry about their kidneys, and where there's peace of mind, early detection, early management, and early therapy. That's what I see as the future of kidney health.
I'm here at the American Society of Nephrology meeting and have been in several sessions where precision-based, personalized, molecular-based therapies are really going to expand. They've already expanded and they're going to explode in the next 5 years. This morning there was a session on organomics, where organs can be developed in the lab, diseases can be developed in the lab.
Wow.
Therapies can be tested in the lab, in a petri dish, in a very safe environment where there's really no human impact, and then taken directly from the petri dish to the patient and to the bedside, which to me is just absolutely mind-blowing.
It's very bright, to be truthful.
Okay.
And the reason is because in the current era, with all these advancements, new therapeutics, new devices, now finally we are empowered to take care of kidneys. I'm so happy not to produce dialyzers anymore.
Yeah.
I am here, I'm a nephrologist, I'm a kidney doctor, and my job is to protect the kidneys. And I'm very happy to be in this era where we are empowered to protect the kidneys.
Awesome.
And that's why future of kidney care is perfect.
So you say the future of kidney care is exciting.
Very exciting and totally bright that I have to wear sunglasses all the time.
All right. Well, thank you very much. Thank you.
Sure, thank you.